Talk Hashimoto's and fertility. I'm going to have to try to keep this one short because I could go off on this one for a long, long time. So I'm not going to get into chemical pathways and things of that nature, but Hashimoto's does affect fertility. One of the biggest connections in fertility, I think, with Hashimoto's is it has a connection to polycystic ovarian syndrome. They've done studies on young gals who are 12, 11, 13, 14 years old, and who had cysts, and they gave them thyroid medication, and their cysts went away. Okay, so again, when I said I have to keep this real, like not go through all the chemical pathways, there are pathways that involve the adrenal glands and blood sugar manipulation that are secondary to Hashimoto's that ultimately create these cysts. People who get polycystic ovarian disease probably understand, or those of you who don't know, is the cause of some studies estimate 50% of the of infertility in this country. So that's a big crosstalk connection between the thyroid and the ovaries. But just in general, Hashimoto's thyroiditis is a hypothyroid condition, and hypothyroid conditions slow everything down. So it just slows everything down. So it slows down your ability to make eggs. It slows down your ability to pop those eggs out. You can't get the egg out. No cycle, no baby. So Hashimoto's works at it from that perspective. I have a lot of women who come in here and they're on hormone replacement therapy for their estrogen, and all of a sudden their thyroid starts getting better, and now they have to go down on their hormone replacement therapy because now they're starting to make more estrogen, and they're making too much, and they're getting all kinds of symptoms of too much estrogen. They're getting heavy periods and stuff like that. So it has a direct effect on estrogen metabolism. It has a direct effect on progesterone metabolism, now in a little different way. So progesterone, so estrogen, you make the egg, you have the baby, you've already made the egg, you came with the eggs, but the egg is now made viable. It's made so that it can be expelled, and the follicle can get into the uterus. That's estrogen. Okay, estrogen does all that. But progesterone makes the uterus so that the follicle will stick, and so that it will hold. Okay, and progesterone has a very interesting relationship with thyroid hormone. Thyroid hormone will sensitize the receptor sites on the cells, okay, so that the progesterone gets in there better. And if you have hypothyroid and you're not producing enough thyroid hormone, or you're not converting enough thyroid hormone from T4 to T3, then you're not going to have your thyroid hormone sensitizing the progesterone. So maybe you conceive, but then you can't carry to term, and you have miscarriages. And women who have hypothyroidism and Hashimoto's hypothyroidism, I think, are 4 times more likely to miscarry. And then another thing relative to thyroid hormone is when thyroid hormone decreases. Okay, thyroid hormone is under the auspices of your pituitary gland. So your pituitary gland tells your thyroid what to do. And so they have a very close relationship. And when we get a decreased hypothyroidism, particularly the most common one, which is Hashimoto's, inflammation can affect that pituitary gland, and it happens mostly during Hashimoto's, but it can happen during a pure hypothyroid. And then you make too much prolactin. Prolactin is the hormone that gives you breast milk, okay? And when you start making breast milk, it kind of tells your whole female hormonal system to stop, because it's saying, no, I think you got a kid. so you don't need to be having cycles and stuff like that. And so from that perspective, thyroid interferes with fertility also. And then there's one indirect topic I think that would be relevant, and that's birth control pills. I just had somebody that I spoke to yesterday who's been on birth control pills for 20 years. So that kind of alters the case a little bit, because birth control pills are birth control estrogen, particularly creams, but it happens with pills. Usually it builds up. Estrogen builds up. Okay, that's what it does. It builds up things. It builds up your uterus, but it also builds up in your system. It needs to be cleared by your liver. It needs to be cleared by your intestines. You need to not be constipated. Estrogen gets into a lot of different places, and then if it doesn't get cleared out, the excess estrogen from the pills, from the creams, the excess estrogen doesn't get cleared out. It kind of gunks up, like I just said, it kind of gunks up the liver, and then that alters a number of things. And one of the things it alters is what's called thyroid hormone binding globulin. That's a fancy name for a protein that when your thyroid makes thyroid hormone, it attaches to a protein. It's like think of it as being like a taxi cab that takes your hormone to where it needs to be. And it needs to be either in the liver, or it needs to be in the intestines, or it needs to be in the cells so that it can be converted into an active hormone. Well, that sex hormone binding globulin starts becoming like, it increases them. And so when it increases them, you start having so much hormone that attaches to those that you don't have enough hormone flying around to go into your cells. And now you have not enough action in your physiology. Your metabolism goes down, and then all the things happen that we talked about when I said hypothyroid just slows everything down, and it slows your estrogen down. So you might be getting taking hormone therapy and getting all kinds of low estrogen symptoms, even though you're taking it, because it's affecting the ability of your thyroid to work properly, or to convert hormones properly so that they work properly. I mean, the bottom line is that thyroid has a massive effect on your female hormones. When I have a case like with the lady that I spoke to yesterday, and the primary observation or the primary desire is I want to get my hormones under control. Before you get to the hormones, you got to clear out the liver, you got to clear out the gallbladder, you got to clear out the gut, you got to get the blood sugar right, you got to get the person's essential fatty acids right, because they also sensitize those receptor sites. And if that doesn't work, then and if that doesn't work, you have to look at the thyroid by that time, because thyroid's a hormone issue too, so you have to look at all of those things for the thyroid. But you'll do the thyroid first before you'll do anything to the female hormones, for all of the reasons that I just got done talking about. So yeah, it has a huge effect on infertility. Hashimoto's does. Again, just the PCOS is considered, just that connection is considered to be responsible for 40 to 50% of miscarriages in this country. So I hope that answers it in a relatively succinct period of time here. So, all right, see you in a couple days with another hopefully interesting topic.